Hello, everyone. Happy New Year during these ongoing unprecedented times. Welcome to McGill Cares, a webcast series addressing a wide variety of topics to support family and informal caregivers. I'm Claire Webster, a former caregiver who became a certified dementia care consultant and founder of the McGill University Dementia Education Program. I work with a dynamic team of leading healthcare professionals to oversee this program, which include Dr. José Moret from the Division of Geriatric Medicine, Dr. Serge Gauthier, McGill University Research Center for Studies in Aging, and Dr. Gerald Fried, McGill Steinberg Center for Simulation and Interactive Learning. These webcasts are made possible thanks to the generosity of donors, and we would like to thank the Lindsay Memorial Foundation for today's webcast. So during these unprecedented times, I felt that it was important to address a very important topic, which is that of depression. My guest is Dr. Gustavo Turecki, professor and chair of the Department of Psychiatry at McGill University, scientific director at the Douglas Institute Research Center, and psychiatrist in chief at the Montreal West Island CIUSSS. Dr. Turecki uses epidemiological, clinical, psychosocial, and basic research approaches to advance knowledge on mechanisms leading to suicide and suicidal behavior. His laboratory has contributed to the investigation of the mechanisms of antidepressant response. In addition to his research, Dr. Turecki is involved in local, national, and international leadership in research, intervention, and knowledge transfer in the field of suicide and depression. Welcome to McGill Cares.
Thank you. Hello, Claire, and everyone.
So I'm so happy to have you here because I think that this is a topic that's very pertinent to everyone. How has the pandemic contributed to the level of depression among people?
So certainly the pandemic has created or has generated a lot of stress on in everybody. And with stress comes often depression. We have seen an increase in search for care, yes, but also it has, I think, sensitize everybody to the importance of depression and other psychiatric conditions, because we all felt somewhat closer to what other people feel in their day-to-day lives.
Mm-hmm. So you were mentioning just before we came on the air that you oversee the psychiatric units in some of the biggest hospitals in the Montreal area. Has there been an increase in people presenting themselves to the emergency for mental?
I think that it's over the period since March, since the pandemic began, we've seen many different things. Yes, so in the beginning, people stayed out of hospitals, then they come back, and then we've seen a marked increase in emergencies. And now, of course, it's we are dealing with all the COVID positive cases as well in mental health. So, for instance, at the Douglas Institute, we have a unit that specializes to take care of COVID patient positives that also need psychiatric care. Yet, so it's the only unit for the whole the larger Montreal metropolitan region. So all of the patients that are COVID positive and need psychiatric care come here to Douglas, and so we have had to adapt the way we provide care. We have to make changes, and that impacts everything because the health system, it's so interconnected, and when you touch a little bit here, it impacts there as well. As I'm sure people have seen in the news, there's a lot of care providers who themselves are affected, and there's increased leaves, either because people become COVID positive or because also they have personal issues that they cannot work.
So let's, if you could just help us understand exactly what is depression and how is it different from just feeling sad or out of sorts, or like last week I was feeling quite actually lethargic. think that's probably a good way to put it. Like, just didn't have the motivation to get up and go as much as I tried. So what is it?
Yeah. So look, feeling sad, it's a part of, it's a repertoire of emotions that we have, and it's part of our normal repertoire of emotions. Yet, so we are sort of wired, our brain is wired to have responses to situations in our life. And so it is normal to feel sad when, let's say, something bad happens in our life. Yes. What is not normal is to feel sad and that sadness lasts for a very long time, or is so intense that prevents us from functioning. Yes. So if let's say we experience sadness without any reason to feel sadness, so that is not normal. Yes. Or if we experience sadness in an intensity and a duration that prevents us from functioning, yes, or then it's also not normal. Yes. Now, that said, depression is much more than just feeling sad. The illness is much more than just feeling sad. Sadness is often part of the equation, but not necessarily. Some people are depressed, but do not feel sad, or do not prominently feel sad. Yes, so it can present with lack of motivation, for instance. Some people have depression, and with the most prominent symptom is lack of motivation. Some other people feel depressed, and the most prominent symptom is fatigue and feeling tired and unable to accomplish daily tasks. So there are different forms of feeling depressed.
And I guess that depression can occur in different areas of your life. For instance, it could be hormonal. Like, there are women that suffer, postpartum depression, or some women, for example, that are going through menopause. So I guess it could be hormonal. Now, could you also explain what is the difference between when a woman feels depressed and when a man feels depressed?
Yeah. So look, the same way that there are many different ways of feeling depressed, and the illness itself manifests not necessarily always the same way. And in fact, we believe that depression is, it's more like a syndrome, with a lot of different types. So typically, you can also identify that men and women manifest the depression differently. Yes. So we even think that the biological processes that underlie depression in men and women may even be different as well. But as a rule, yet men that are depressed tend to have not manifest so much emotional distress, as women do, and have a little bit of differences in some of the symptoms. Often what is more present, it's sort of an irritability, and sometimes a little bit more aggression, as opposed to necessarily sadness. But all men as well can manifest sadness. But if we generalize, that's often what happens, and then women present more of the larger repertoire of symptoms.
Now, if people don't receive, because and I guess not everybody goes and gets support for it at the outset of it. How does it evolve over time? Like, what impact could it have?
Mm-hmm. So look, it's because depression is so variable. Yes, there are many different forms of depression. Yet there are some forms of depression that are sort of self-contained, if you wish. Yes, so that people would begin presenting symptoms. These symptoms were sort of plateau at one level, and then they will disappear. Yet, so typically this is more sort of the milder forms of depression. Yet, that often do not require medication or do not require a more intense intervention. So they would be self-contained. Now, it may be an issue of weeks, for the diagnosis of depression. Typically, according to the criteria that we use, we require at least the presence of symptoms for 2 weeks. Yes. So, if in the case of some patients, what you would see is that, let's say, they would have symptoms for a few months, yes, and then the symptoms would go away. But these are typically the milder forms of depression. Yes, when the depression is a bit more severe, then often just waiting is not enough. Yes, the symptoms of depression impact capacity to function. The person won't be able to, let's say, continue working, or if we'll continue working, it would be to a lot of effort, to the detriment of everything else the person does in his or her life. Yes, so then it may be variable. Then the function of the treatments is essentially to shorten the duration of the illness, yes, so that the person can go back to his or her normal state. Yes. Sometimes depression will last for a few months, sometimes it would last for a few years. So it really is variable. Yes, there's no, I think if I can give one single message, through this webcast, is that there's no single way of being depressed. Yes, there are many different ways of depression. And so when there are depressions that are very, very severe and that handicap the person, and the person will no longer be able to go back to its previous state. Luckily, these are more rare forms of depression, and there are other forms of depression that are mild, and the person can just go by even without treatment.
So for many years, I mean, because this webcast is, geared a lot towards care partners. And for many years, when I was caring for my mother who had Alzheimer's disease, my go-to in terms of my emotions was anger. I mean, I was in a permanent state of anger, and which at the time I did not recognize was depression, but I was just permanently angry. And one of the unhealthy coping mechanisms that I had adopted was wine, and drank a lot of it. So what would you say are some of the most unhealthy coping mechanisms that people are turning to manage their depression or anxiety or stress right now?
Yeah. So for instance, so what you mentioned is a very common coping mechanism. Yes, that people take drugs to alleviate the suffering. Yeah. So a very common symptom of depression is it's feeling anxious. Yes, feeling. So another very common symptom of depression is insomnia, difficulties to sleep. Yes, so very commonly people would drink, for instance, to relax and to facilitate falling asleep. Yes, or would use cannabis, for instance. That's very common as well, that people would use as a way to facilitate sleep. And so these are very common coping mechanisms. Other people would gamble, for instance, or do other activities, excessive eating as well. That there would be activities that decrease anxiety, basically, or decrease the level of tension that the person is experiencing. The problem with these coping mechanisms is that they don't address the problem. Yes. So this is like, for instance, if you can make a parallel, it's equivalent to, let's say, if you have a pneumonia, you're treating the fever, or doing something about the fever, but doing nothing about the cause of the pneumonia. Yes. And then, so they are not effective in the long run. They may help a little bit, in a day to day, but in the long run, they are not effective, and then they can actually cause other problems, like for instance, problems with addictions and so on and so forth.
Well, like I never really realized until many years later that, for instance, alcohol was an antidepressant, so I would use wine to numb myself to try to feel better, but then the next morning wake up and feeling horrifically depressed, and and then started the whole cycle, just kept starting over and over again, right? So you drink to try to numb your feelings, but then you wake up and all the feelings are in front of you, you're not sleeping. So I mean, and I see this cycle with so many individuals like myself. So what treatments are available? I mean, what do you recommend?
So look, there are there are a lot of different treatments for depression. Yet you have the pharmacological treatments, which are typically antidepressants, which and there are many types. And the reason why there are many types is because no single treatment works for everybody. Yes. So but collectively they're very, very effective, and often we're able to find a treatment that works for everybody. Yes. So pharmacological treatments are a very important source of treatment, but they're not the only one. That you have as well psychotherapies. Psychotherapies are effective in helping people deal with mechanisms that they have developed over time that are at the core of the depression sometimes, or that feed into the depression. And they help identify where the problems are and then find solutions. Yes. So, for instance, one way in which, often what feeds into depression are either interpersonal difficulties that we have, or self-criticisms that we have about, the way we act or perform. And so the psychotherapy would help people address those problems and therefore avoid becoming depressed. Now, or minimize it. There are other ways where you can address as well depression, either by addressing lifestyle issues, yes, and helping with establishing routines and establishing the person have increased discipline in day-to-day, because we are wired in a way that we like routines. Yes, our organism likes routines, and we need to sleep regularly at the same hour. And we need to sleep, between 6 and 8 or 9 hours, depending on the person. And so when all these things are unbalanced, sometimes they can lead and trigger depressions. So we have to look at each person, yes, because as I said, there's no single way of being depressed. So we have to look at each person's case, identify where are the issues, and then look at possible solutions to those. Yes. In the case where the depression is very severe, of course, we'll need definitely to introduce pharmacological treatment. Yes. And sometimes more than one treatment is necessary. Yes, more than one medication is necessary, because sometimes the depression doesn't respond to a single antidepressant, so we need to identify what would help. So exercise, for instance, is also extremely helpful. We have data from the literature that regular aerobic exercise helps a lot, keeping mood levels stable. So typically what we would do is is assess the situation, look at what this person needs, and then design, so to speak, a treatment that is personalized to the patient.
So how does a family member or a care partner best support a loved one that has depression? Because I mean, I can imagine that it could be quite challenging at times. So how does a family member best support?
It is challenging, yes, particularly for the depressions that last a long time. Yes, so as I said, in some cases, the depressions can last of years. Yes, and then it is, and the person is unable to function normally, and it's unable to work, and that it's and it may last for years. And so for the family members and for people around the person, it's very difficult sometimes to understand, because it's not like, let's say, if the person had broken a leg or had something that is visible, yes, or if he had cancer. Often patients would say that, I wish I had something like an illness like cancer or something else where people could see more easily and accept it better, because often it's difficult for people to accept, because the perception, yes, in the in people is that that there's nothing wrong. Yes, so why isn't he or she getting its act together and getting up from bed and doing something about it? Yes, and everybody has advice to give, which is very difficult for the person who is depressed. Yes, so the first thing which is important for the caregivers and for the people around the person is to understand, yes, what's going on, to understand the illness, understand that it's not because the person is not doing things that it's not moving or is not getting better. So it is difficult. I think my best advice is to try to understand, in general, although, obviously there are cases and cases, but in general, I think education is the best thing. Yes, it's knowing what's going on, and understanding often helps.
And so now, let's say during this time of isolation, I mean, how do people access support? I know that the Quebec government, there's ads, for instance, saying, for that there's support for mental health. So how do people access support? And also, I mean, I guess the first step is admitting that I need help. Where do I go? Do I contact a family doctor? Do I contact the CLSC? Like, how do I get that support that I may need?
Yeah, so there are typically two ways of getting support to the medical system, yes, to deal with depression. So most of the family doctors are able and very capable of helping, assessing, and identifying depression and establishing a first line of treatment. Yes, and then when the family doctor has done his or her job, and then it for some reason didn't work out, then they would refer the patient to a psychiatrist. Yes, so that's one way of having access to the medical system when it's necessary. The other way, it's through the CLSCs. Yes, all of the CLSCs have something that in French is called Guichet d'Accès en Santé Mentale, which is basically a first step in access to mental health, and where people can have access to non-medical treatments for depression. Yet, so in other words, for psychotherapy, support, counseling, yes, and so they don't need a medical referral for that. They can go, it's self-referred. They just have to go and present to any CLSC, and they would have access to that. Yes, so the resources are unfortunately not ideal. Right now, it's not that that are enough for everybody. So the government it has announced over the last few months that they would increase support, it will increase financial support to make it more available to everybody, non-medical treatments like psychotherapy. So all of the health networks are looking into how to make it happen. So either through contracts with the private sector, etc., so that people can have access to the support. And of course, for those who either have an insurance or can afford, there's always all the private psychologists.
So I know that I only have probably time for one more question, but again, I'd like to ask you, because during these times of isolation, where a lot of people are feeling like they're under house arrest, people are losing their jobs, more and more people are going to suffer from depression or severe anxiety. What would be some very severe warning signs where you recommend people must go and seek immediate medical attention?
Yeah, so often depression manifests itself first, yes, very commonly by changing either sleep or appetite. Yet, so when people see that their sleep patterns spontaneously change, yes, they have a hard time falling asleep, or they are sleeping too much, yes, because either is lack of sleep or oversleeping. And I mean, if it's a day or two, it's all right. We always go through days that we have a harder time. But if you have been, let's say, for a week or so or more, yes, that you have been having difficulties to sleep or been oversleeping and you feel tired all the time. So these are all very common first signs that something is wrong. So again, if this is persistent, it's a good, it's like something that you should pay attention to. Yet, and then often, with that comes fatigue, lack of interest, and sadness. Yes, some level of sadness. Or irritability. So these are lack of interest. Like you no longer interested in things you usually enjoy. So these are warning signs that people should be aware of, and that if they are present, they shouldn't take lightly. If they're present, for several days.
And I'm assuming also suicidal threats or care partners who are with or family members where I guess a loved one is saying, I want to kill myself, I can't take it anymore.
Absolutely, absolutely. So if people are talking about this or even thinking about that and not talking, I think this is something that you should not take seriously. You should take seriously. You should not oversee.
You should take that. Well, I guess I could speak to you for another half hour, but I recognize that your time is limited today. But thank you very, very much for coming on McGill Cares, and I hope to have you as a guest again in the future.
Thank you very much, Claire, and thank you for your interest.
Thank you very much. So next week, we will be having another very important topic, and we'll be discussing recognizing when coping mechanisms become addictions. My guest will be Dr. David Lukow, family physician at the Montreal West Island CIUSSS in the Youth Mental Health Clinic and a clinical lecturer at the McGill University Faculty of Medicine and Health Sciences. Dr. Lukow will address issues related to the use of alcohol or drugs as a coping mechanism, and he will discuss how to recognize when this is becoming a problem, and will share information about treatment options. This webcast is an initiative of the McGill Dementia Education Program, which is funded by private donations. Once again, I would like to thank the Lindsay Memorial Foundation for supporting today's webcast. If you would like to make a contribution to our program or for more information, please visit us at mcgill.ca/dementia. And if you would like to get in touch with us with some suggestions or questions, please email us at dementia@mcgill.ca. Thank you for watching, and we'll see you next week.